This story comes from the New York Times. Kennedy links measles outbreak to poor diet and health, citing fringe theories. Last week, I want to take something back. Last week, I was like, hey, in the wake of the outbreak, it appears like Kennedy is encouraging vaccination.
Well, in that story, we saw that.
Yeah, right.
But it's not true.
It's not true.
Yeah.
Yeah, it's not the case. In the spirit of saying only true things, the Health and Human Services Secretary, the Health Secretary, suggested that the measles vaccine was that doctors were getting miraculous results or near miraculous results with like fucking cod liver oil and fucking back rubs or some bullshit.
Yeah.
Like nonsense. And that like getting measles might not be that bad because then you don't get certain kinds of heart disease and cancer. Not true at all.
Yeah.
Like literally nothing he says is even remotely truth adjacent.
How is he you're in charge and you don't know what you're doing.
Yeah, well,
I know that happens a lot in the United States.
I'm employed.
I know that happens a lot. But genuinely, you're in charge and you don't know what you're doing at all.
Right.
And this is a really important fucking job.
Yeah.
And you're seeing that the numbers are still climbing. It's not like that they had got rid of it. It's not like the measles stuff's been taken care of down in Texas.
Well,
sorry.
I'll tell you this, like Haley and I were talking and like, we're going to take ourselves and our kids and we're all going to go get MMR boosters because there's no reason to think that the measles outbreak in Texas, A, will not continue, B, won't spread, or C, won't just pop up somewhere else.
Yeah.
Like I know that it originated from a Mennonite community and that community was like very poorly vaccinated, but this country's full of poorly vaccinated communities.
Yeah, absolutely.
I
would argue that there's some pretty large communities now that are very popular and full, like that are communities that we would easily interact with. I realize the Mennonite community might not, but there's plenty of communities out there now that are not vaccinating that you could easily, it could be half your school.
Yeah, man. And the thing is, in order for the herd immunity effect to really work for measles, because of how infectious it is, that herd immunity rate, that vaccination rate needs to be in the mid to upper 90s.
Yeah, it's got to be high.
And it's not that high.
Nope.
It's below that number now. So we don't have the herd immunity effect.
Yep.
And I was just like, Haley and I were talking, I'm like, well, why don't you just go get MMRs? Like there's no harm in doing it. I'm not going to fucking turn into a 47-year-old autistic by getting it. Like I'll just be a little safer because it wouldn't surprise me at all if a measles outbreak popped up in one of my kids' schools.
Sure.
Like I would be 0% shocked if I got that letter at home. I'd be like, yeah, it's fucking, of course it did. Why wouldn't it?
Yeah. Yeah.